If you had to say you're an entrepreneurial in the mental health profession, what are the top three, whether you're individual private practice or group practice, what are like the top three challenges they're dealing with today? The pain of growing either a private practice or a group practice in the mental health space. What do you see with those that you're interacting with today?
So if I would have to select three pain points that I see everyone basically struggling with, no matter if they're a large portfolio or a small mom and pop shop, would be credentialing first, credentialing extension. If your providers are not credentialed in a network, you just don't get paid. And that issue usually starts before provider even starts working there. So let's say if you hire someone today and start with the credentialing process, now you're looking 120 days maybe before the provider can start. So who's taking care of the patient for the 120 days? So if you have someone leaving, you have to constantly keep track of that. And also, as we know, payers have always new regulations, new requirements, new loops that you have to kind of jump through, and making sure that you get those negotiated good contracts. So that would be number one, credentialing. Second one, revenue cycle discipline, reducing denials, improving first-time claim acceptance. That is something that drives cash flow. And it's most of the practices have, issues with collections, too many days in AR, and for different reasons, right? One can be just not enough manpower to review KPIs, dashboards, and stay on top of everything, but then also fragmented technology and processes as well. And then the last one, I would say patient engagement, simple systems. And this is the easiest one to fix, setting up some like appointment reminders, digital intake, telehealth waiting rooms. Those can cut cost, no-shows by like 20-30%. And that's kind of easy. But, it's not just like about the tech. It would be also, the communication that builds the trust. But if I would have to select like three pain points, those would be the ones that I would target.